I'm Dr. Derek Lee. Today, we're going to learn the simple steps to optimizing your immune system. We'll learn why calming down the immune system is the secret to strengthening it, learn how the immune system works so you can manage it. We'll also look at how chronic symptoms are a result of uncontrolled inflammation. We'll learn how ongoing stress drives brain, organ, and body inflammation, and we'll learn, of course, the simple steps to easily optimize your immune system.
Let's start with this chart. It looks complex, but I'll break it down for you guys. It's the immunology of inflammation and pain. Really, at the beginning of an immune response, there's no real difference between how our body reacts to injury, bacteria, or viruses. And these are other contributing factors. But let's focus on the initially immune response first. If we look down at the bottom of the page here, where we have some bacteria and tissue damage, when that occurs, those damaged cells start to release signals that start to diffuse through the area until it hits some nerve endings. So these nerves will sense a danger signal and will transfer that up to the brain, which acknowledges it and perceives it as pain. So really, in actual fact, the brain is where all pain is perceived. It's all in our head. Now, these signals will continue towards the capillaries or blood vessels, where these neutrophils, these green cells, will start to penetrate the blood vessels into the surrounding tissue. They'll migrate all the way down to where the damaged tissue and the bacteria are. At the same time, these cells will start to release their own signals, which will call in what are called monocytes, which will transform into our macrophage dump trucks. Now, these dump trucks are important because once the damaged tissue and the bacteria are engulfed, packaged into nice tiny bundles of garbage and thrown into these dump trucks, and it is further removed by the lymph drainage system. It's important to note here that this is the normal immune response, where the number of neutrophils, the green guys, is equal to the number of dump trucks. It's a 1-on-1 ratio. Alternatively, what can happen is that if there are too many neutrophils and not enough dump trucks, then we go to the left. These neutrophils will die in 6 to 10 hours if they're not removed. So if the contents are still hanging around, they'll eventually explode and release very harsh toxins into the surrounding tissues, which turbocharges this whole reaction and sets it off. In this case, there's either high or low immune suppression, which really means that the number of neutrophils is greater than the amount of macrophages. So our bodies and tissues cannot remove the debris fast enough. That's what we looked at here in the immune response, which is the same. And that produces normal inflammation, which we all need to heal. And a normal immune suppression, everything is at a 1-to-1 ratio. Inflammation resolves and we become healed. Now, once the inflammation resolves, that's perfect. That's how it's supposed to work. But in other circumstances, that immune system keeps going, and that's what causes the chronic inflammation. Now, for different individuals, we have 3 different situations. The first one is completely normal. If you had an infection, which is in yellow, inflammation, which is in green, and immune suppression, which is pink, what happens initially, normally, is that when you have an infection of a pathogen, inflammation rises because of our immune response to deal with it. The infection dissipates and is resolved. Inflammation continues, which is normal, and eventually there's resolution. So this is how it should work. But sometimes, if you have that initial infection, you have a huge, overwhelming immune response. And you would think that's a good thing, but it's actually too much. But the infection is killed off, but you don't have any resolution, just ongoing high sustained inflammation. And that's a problem. The third condition is that you have the initial infection, you have inflammation because of the immune response, but the inflammation doesn't get high enough to put out the infection. So the infection keeps going, and your immune system tries to fight it, but it can't. And as a result, there's no resolution. So when you have these two situations of low immune suppression or high immune suppression, low immune suppression, high immune suppression, low being no infection but high inflammation, and high immune suppression being ongoing infection and ongoing inflammation, then that drives chronic inflammation. So in a nutshell, we go from an immune response which is normal to an abnormal immune response which causes chronic inflammation. With the chronic inflammation, that feeds brain inflammation. So we might see issues with depression, anxiety, anger, brain fog, focus issues, frustration, etc. And that brain inflammation can drive chronic inflammation. So it amplifies both ways. The same thing happens with dysbiosis, which is bacterial overgrowth in the bowels. That can produce SIBO, which is small intestine bacterial overgrowth, and that's where bacteria that are normally in the large intestine or further down the GI tract are actually pushed up into the small intestine, and we have all these symptoms as a result. So the dysbiosis is fueled by chronic inflammation, but it can also fuel chronic inflammation. Stress, massive component to chronic inflammation. Think about it, our brain's already inflamed, dysbiosis, our bowels, our skin, respiratory system, you name it, we're feeling lousy, that'll increase our stress. And when we're stressed with cortisol increasing, that increases chronic inflammation as well. Now, all in all, once you have the chronic inflammation, it will feed down and completely suppress our innate immune system. So that initial immune response gets even more corrupted. That results in increased infection, so it increases this whole loop. Now, chronic inflammation, combining with stress, can also reduce Th1 status. What's that? That's a type of white blood cell. It's called T helper cell 1. This is T helper cell 2. When T helper cell 1 status drops because of the chronic inflammation and stress, it drops the innate immunity, which increases susceptibility to infection, driving the inflammation. So we get into these multiple loops which fuel the inflammation issues. We can also touch slightly on Th2 status because it's really important in terms of inflammation of hollow spaces being on urinary tract, upper respiratory tract, allergies, sinusitis, and all those things. So Th1 status drops, Th2 status increases, these symptoms get worse. And actually, if these two keep going, one going down, one going up, this will drive autoimmune inflammation as well, which reciprocates with chronic inflammation. So how do you deal with this whole mess? Where do you even start? The way to start is to discover what your Th1 status is, find out what your Th2 status is. I'll provide 2 questionnaires which will help you determine these. And once you know these statuses for Th1 and Th2, if we can increase or reverse this arrow so it's pointing upwards, if we can increase the Th1 status, that will increase our innate immunity and it will help to resolve infections. This will lower the Th2 status, which will reduce these symptoms. But don't forget, these work in opposite directions. So if we can increase this will lower this. Okay? So to summarize, how do you deal with chronic inflammation? We have to determine if it's due to low immune suppression or high immune suppression. And once we do that, we can determine your Th1 status, Th2 status, and by balancing these out so they're not as extreme, we can manage chronic inflammation. Thanks for watching this video. I hope it was educational for you. I'm Dr. Derek Lee.